Every night, of course, we bring you the numbers here. And this evening, the coronavirus has now taken the lives of more than 18,000 people in this country, more than 2,000 in the past 24 hours.
Tonight, over 100,000 dead from coronavirus worldwide. In the U.S., the death toll now over 18,000.
The bad news isn't just bad. The bad news is actually terrible.
New York setting another one-day death toll record, 779 people. And the governor saying that number will rise as more patients struggling in the hospital lose their fight.
We have made it through another week together, and tonight, even as the death toll continues to grow, another horrific 24 hours in New York alone, 777 lives lost in one day.
Every criminal investigation worth its salt has the main prescribed directive, follow the money, with the accompanying question, key bono. Who benefits? A couple days ago, I had a video where I showed Dr. Jensen where he asserted that hospitals make $13,000 per cerveza bug patient, and if they put that patient on a ventilator, that hospital gets $39,000. So I wanted to prove that to you right here. Everything that I'm about to talk about, I'm going to leave every link in the description below so you can look this up for yourself. Hospital reimbursements for uninsured cerveza bug patients may total $42 billion. We're going to talk about the CARES Act, which is the Coronavirus Aid, Relief, and Economic Security Act, in a second. Hospital reimbursements for uninsured cerveza bug hospitalizations will range from nearly $14 billion to $42 billion, accounting for a significant portion of the $100 billion slated for hospitals in the CARES Act. And that's very important to remember. Hospital reimbursement for the treatment of uninsured cerveza bug patients could account for more than 40% of the $100 billion earmarked for hospitals in the latest coronavirus stimulus package, and I said that word, according to estimates from Kaiser Family Foundation, and we know all about those guys. In a new issue brief, researchers from the Kaiser Family Foundation estimated total hospital reimbursements to range from $13.9 billion to $41.8 billion, depending on the rate of and severity of cerveza bug hospitalizations among the uninsured population. And check this out. That reimbursement range is based on Medicare reimbursements for hospital admissions for similar conditions, like, I don't know, maybe the flu, including respiratory infections and inflammations with major comorbidities, or complications. That's another important thing, which averages $13,297 in reimbursements, and in more severe cases, respiratory system diagnosis with ventilator support. That's why they're pushing those ventilators for greater than 96 hours, which averaged $40,218. And you think about this. They're pushing for people to get these tests. Everywhere you look, mainstream media is pushing it. Government functionaries are pushing it.
Yes, actually, at the last task force meeting, the individuals responsible for both developing, validating, and getting the test out are saying, and I'm certain that that's going to happen, that within a period of a week or so, we're going to have a rather large number of tests that are available. One of the things that you mentioned that's important, because other countries have gotten burned by this. These antibody tests are tests that we do on other diseases, but they need to be validated. You need to make sure that they're consistent and that they're accurate.
And that's the thing, guys. Up to this very day, these tests have been highly inconsistent and highly inaccurate.
Tonight, the president says the government has done 1.7 million coronavirus tests. But now the CDC is conducting a different kind of test to find out who has recovered from COVID-19 without ever knowing they had it.
They plan to test 3,500 randomly selected residents, invited by a phone call from Miami-Dade County Mayor Carlos Jimenez.
I'm asking you today to participate in a groundbreaking program designed to determine how many people in Miami-Dade County have been exposed to this virus.
We don't only want individuals who think they've been sick. We want individuals who are asymptomatic.
Do you think this kind of testing should be ramped up to the whole country?
I think any kind of testing that could give us better insight into the burden of infection and the number of individuals who are asymptomatic but infected is critically important.
Check this out. Estimated cost of treating the uninsured hospital with cerveza bug. The 3 Cerveza-Bug stimulus bills that Congress has passed provide additional funding for hospitals and for free Cerveza-Bug testing. Always got to push that testing. We want you tested, even though the tests are highly inaccurate and unreliable. For the uninsured through Medicaid, while Congress did not allocate any money specifically for Cerveza-Bug treatment or coverage for the uninsured, President Trump has stated his intention to reimburse hospitals for treating the uninsured by tapping a new $100 billion in funding for hospitals and other healthcare entities, including the third stimulus, the C-Virus Aid, Relief, and Economic Security Act, also called CARES. But there's more than just the 13,000 and the 40,000 number. To project how much hospitals would get paid by the federal government, that's actually by the taxpayers, the tax cattle, for treating uninsured patients, we look at payments for admissions for similar conditions. For less severe hospitalizations, we use the average Medicare payment for respiratory infections and inflammations with major comorbidities or complications in 2017, which was $13,297. For more severe hospitalizations, we use the average Medicare payment for respiratory system diagnosis with ventilator support for greater than 96 hours, which was $40,218. But pay particular attention to this part, because this is where even more money is piled on to those already exorbitant numbers. Each of these average payments was then increased by 20% to account for the add-on to Medicare inpatient reimbursements for patients with Cerveza-Bug that was included in the CARES Act. Who benefits? Follow the money. Guys, America is getting financially raped. But wait, there's more. How much exactly do these tests cost? CMS releases Medicare reimbursement details for Cerveza-Bug tests. Medicare reimbursement for Cerveza-Bug tests will be about $36 for the CDC test and $51 for those created in-house or by other entities. Here's the information right here. CMS emailed providers last week with a price list for COVID-19 diagnostic tests. The list stated that laboratories testing patients for the novel C virus using the CDC's test will receive about $36 in Medicare reimbursement, while those non-CDC test kits will receive about $51. There's money being tossed around left and right at the expense of the American tax cattle. And mainstream media, which is the public relations and propaganda arm of the military-industrial complex, as well as the White House, keep running these high-dollar ads, and that's exactly what it is anytime you see a news segment, for all the pharmaceutical companies and biotech companies who are making a killing. So all you got to do to find out what's really going on is follow the money and ask the question, cui bono, who benefits? Because it's not you. Even if you get a test, it's highly inaccurate. And let me just remind you, here's how the CDC says you can lie on the death certificate. Should CV-19 be reported on the death certificate only with a confirmed test? You don't need no stinking test. Why? Because the CDC says CV-19 should be reported on the death certificate for all decedents where the disease caused or is assumed to have caused or contributed to death. All any doctor or nurse practitioner has to do is just assume. You don't even need a test. And if you had the test, it's highly inaccurate and extremely unreliable. But if they give the test, you can get $36 every time you administer it, or $51. And if you receive a CV-19 patient, you get over $13,000 for your hospital. Oh, and if they need a ventilator, $40,000 to $42,000 per patient. Plus a kickback from Medicare for all those ventilators. Follow the money. Who benefits? I'll leave all these links in the description below. Do your own research. America, world, we're getting screwed. We're being lied to, and we're the ones who are going to foot the bill. Leave your thoughts about this for the world and the Google Thought Police in the comments section below, and I'll see you guys in the next heavily censored shadow ban video. For the first time in my life, I'm going to the store and seeing empty shelves. It started with toilet paper, then disinfectants. Now I'm seeing empty eggshelves. And it's difficult to go on a day when they have chicken, beef, or even rice in stock. And if people were fighting over butt wipes, imagine what's going to happen when people start starving. Let's face it, panic is the natural reaction for people who are unprepared. If you are prepared, there's no need to panic. Panic breeds chaos, especially where groups are concerned. And if it's one thing we've learned, you never want to underestimate the power of stupid people in large crowds. Chance favors the prepared mind. So guys, if you don't have enough nutritious, storable food and you need to be more prepared in case things get worse, go to preparewithhighimpactflix.com and grab your 4-week emergency food supply. Because of the massive demand, they're shipping on a first-come, first-served basis. The orders can be delayed 8 to 12 weeks, but believe me guys, it's worth the wait. This food is nutritious, delicious. It's 2,000 calories per day for 30 days. There are 12 food varieties with up to a 25-year shelf life, and you'll save $100 by ordering today at preparewithhighimpactflix.com. And because of the high demand, there's a limit of 3 per household. Your link is in the description and in the pinned comment. Remember, it's better to have it and not need it than to need it and not have it.